So good morning, our guests and our school directors. I want to take this opportunity to welcome each and every one of you into our webinars today's webinar, being the first, of course, as the year began. We'll be talking about managing safety and health for schools. And with us, we have Mr. Vincent Mwanza from EnviroLink Consultant, who is also a specialist when it comes to environment audit, matters to do with safety, fire safety, and health. And for that matter, for the interest of those people who are joining us for the first time, let me take an opportunity to just introduce who Ed Partners is. Ed Partners Africa is a financial institution, or what we term credit-only financial institution, that focus on edu financing, specifically giving loans to private schools. So without any further ado, and with that brief description about Ed Partners, I want to have an additional of the fact that we are here to support you, both non-financially and also financially. Hence, having our webinars and trainings just to help you improve on how you can operate your schools. Over and above, I want to just say that part of the products that we offer as Ed Partners include school development loans, transport loan, technology loans, and also upgrade loan. So we want to let you know that yes, as Ed Partners, we are here to offer you solutions that are school related, targeting private schools. And we want to welcome into our today's webinar. Please share with the rest of the education community, the rest of our school directors who are not present. Let them know that we have started our webinar, and we are hoping that you will learn something. Your capacity will be enhanced so as to manage the school very well in terms of safety and health, and also to ensure that you're offering a safe learning environment for even the learners. So without any further ado, I want to welcome Mr. Vincent Mwanza. Karibu, Mr. Vincent.
Thank you so much, Betty, for this opportunity. I take this time to welcome each and every one of us to our today's session. And as Betty has introduced or said in introduction, today we just want to have a small discussion, presentation around managing health and safety in our schools. So you are quite welcome for us to have this engagement. Now, in this presentation, we're going to come across a few abbreviations or acronyms. So whenever you see them coming up, this is what they will mean. We come across a word like DOSH, which is Directorate of Occupational Health and Safety Services, the body that manages matters to do with health and safety in this country. You come across the initials H and S, which stands for health and safety. There will be ILO, which is the International Labour Organization, MOE, which means the Ministry of Education, being that we are schools and this is our governing body. OSH will stand for Occupational Safety and Health. OSHA will mean the Occupational Safety and Health Act of 2007, and this is the law in Kenya which regulates matters to do with health and safety. The word PPE will mean personal protective equipment. The term SOP, SOP will stand for Standard Operating Procedure, and UN will refer to the United Nations. Now, by way of introduction, when we talk about safety and health in schools, basically we are looking at this discipline or this we're talking about this discipline that deals with the prevention of work-related injuries and diseases, as well as the protection of and promotion of health and safety of persons in a given workplace. And this concept of health and safety at its basis or its roots in anticipation, recognition, and evaluation and control of hazards arising in or from workplaces that could impair the health and well-being of workers. And in our context, of also learners. And it is all about preventing the teachers, the students, the non-teaching staff from being or from incurring harm by work activities or becoming ill within the workplace or within the institution that they are in, and do that by providing a safe working environment. Now, just to, in that definition, you've seen we talked about hazard somewhere. So hazard, whenever we talk about an hazard, we refer to anything that has potential to cause adverse effect or ill health. Anything that has a potential to cause a negative effect or cause harm or ill health. And whenever we talk about risk, we are referring to the probability of such an hazard resulting into that harm or ill health or injuries. And when we talk about workplace health hazards, we are referring to factors or conditions in the work environment that may lead to ill health and all occupational diseases. So some of these acronyms and these diseases and this definition will carry along as we go through the presentation. Now, just to highlight some of the incidences or occurrences that we have had in the recent past in Kenya, in Kenyan schools that touch on health and safety. I just highlight about 3, 4 of them or 5, but I'm sure you can date too many. And one of the most tragic one happened in 2020 at a primary school in Kakamega, where unfortunately 15 lives were lost, resulting from a stampede in the school, where students were scared and trying to run out of the school, ended up causing a stampede, and unfortunately 15 lives were lost. Again, and this is now this is within the institution. In February 2013, we had an unfortunate incident also in Garissa, in a school in Garissa. Now, this one involved something outside of the school, but that would have caused serious outcomes, ramifications if it succeeded. And an attacker, a terrorist for that matter, was trying to plant a device, a bomb or an explosive device. And unfortunately, it exploded on him. And it didn't affect the learners, but ended up being an incident in that school. In recent days, last year, we had this very distressing incident at a secondary school in Western Kenya again, Mukumu Girls High School, where some lives were lost and others were hospitalized, resulting from suspected food poisoning. And again, in the same year, around September, we ended up losing a student who fell from a dormitory in Maseno School. In this year also, 2 weeks ago, we had an incident that was involved a minor on school transport who unfortunately fell and ended up being crushed by the vehicle. Of course, there are also others that involve playgrounds where when learners go out to do sporting or those outdoor activities, and cases where we have lost lives or major injuries have occurred within our schools. So this is just to highlight some of the things that have happened that we have heard of. I'm quite sure we know many cases. We've heard of quite diverse cases involving safety and health that has affected our learners in our learning institutions. Now, the health and safety management in Kenya is guided by a framework of laws, acts, and conventions. And this comes from the global arena, the country, and even to department-specific legislations. And to start with, the United Nations Convention on Rights of the Child, that is the UNCRC, a framework, is an international binding convention or framework that principally aims at safeguarding children's well-being, wherever they are, and knowing that children will spend most of their time during the day in schools, and therefore this convention sought to ensure that a child is safeguarded wherever they are, including schools. The International Labour Organization, the ILO, has conventions on health and safety, also aiming at ensuring that every person is safe wherever they are for purposes of work and also for purposes of education for the learners. And this has been ratified by all nations, including Kenya. The Republic of Kenya has ratified that convention, and therefore it applies to Kenya. Now, when you come to Kenya, the Constitution of 2010, Article 42, gives each and every person, young or old, a kid or a grown-up, the right to a clean and safe environment, in that it's the right of those children, it's the right of workers in a school, of teachers and everyone, to have a clean and safe environment. And below that, in Kenya, like I introduced by saying, health and safety matters are regulated through an act of parliament, and that is the Occupational Safety and Health Act of 2007. And this act, as other legal frameworks, what we call subsidiary legislations, that support it. The act, again, gives obligation to operators or occupiers or managers or directors of entities to ensure safety and health of all the people within their establishments. To do that, the Act has different regulations, what we call subsidiary legislations, touching on different things. For example, we have legislation on first aid, legislation on fire safety management, we have legislation on food safety, legislation on machinery, and all these installations that we have in diverse workplaces or establishments. Closer home to our schools, we have the Basic Education Act of 2013, which also places emphasis on the safety of learners and teachers in schools. And in 2008, again, the Ministry of Education gave a safety standard manual for schools in Kenya. And closely in 2018, also Kenya inaugurated a framework for health and safety policies in schools. So these, among other supporting legislation, form the framework through which we can talk about occupational safety and health. So it becomes a legal thing. It becomes a compliance thing that we need to ensure that we are compliant with all the provisions as guided by the law. So under this legislation, under the frameworks that I've listed, specifically narrowing down to the Health and Safety Act of 2007 and the Ministry of Health, the guidelines on safety and health in schools, different players have been given responsibility in terms of health and safety. And in our context, we're just looking at the occupier, or rather the director or the end teacher in a school. So the senior most entity in an establishment, depending on how an institution is organized, has a responsibility to pass down this health and safety agenda to make sure that it is mainstreamed in everyday activities of their institution, with the main aim of ensuring that at the end of the day, everybody is safe and everybody has a healthy environment to learn and also to work in. So the director or the head teacher has a responsibility to, number one, make arrangements for ensuring safety and absence of risks to health in the school. And this comes in in how you design the school. If you are doing a new building, how the designs are done. If it's a dormitory, have you factored in alternative exits? Say there's an emergency. Your buildings have an alternative exit? Do we have a way to raise an alarm? Do we have even smoke or fire detectors in place and sirens for alerting the people, say something is happening at night? So that is the design part of it. And assuming that is there, we have a system of auditing, of just making sure over and over again that everything is supposed to be covering, whether it's the playgrounds, whether it is the classes themselves, whether it's the transport, the buses and all that. We have a way of doing inspections or auditing just to make sure that everything is as it's supposed to be. It's also supposed to make arrangements for training so that the people there, especially the teachers and non-teaching staff that are charged with the management of the institutions, have the knowledge and the capacity to discharge or to inculcate this other safety agenda in the day-to-day activities of the institution. Again, also supposed to provide for supervision. Now that we have set up all these things, can we supervise to make sure that things are done as they should be, whether it's the learners, whether it's the people who contract to do different things, or even the employees themselves. Are they doing what is supposed to be done? And also to provide the necessary personal protective equipment. Whenever we are engaging in activities, do we have the right personal protective equipment, whether for the the workers, they have the shoes, they have the uniform, they have the right tools. So that is the responsibility of the director or the head teacher in the school. They are also charged with the responsibility of providing information, instruction, training, and supervision to ensure safety and health of every person and every learner in the school. So what we mean here is that the occupier needs to know different provisions, different compliance requirements, different guidelines and instructions that are issued, and ensure that they are provided to everyone in their institution. There's also a requirement to maintain the workplace in a condition that is safe without risks to health, and the provision and the maintenance of egress. Egress talks about the whole means of exiting a facility in the event of an emergency. Are we able to respond to any emergencies happening in our institutions? Have we provided the means? Do we have arrangements even with hospitals or ambulance services or the county fire departments? Do we have those arrangements? Do we even have our own internal arrangements and people with the responsibilities of ensuring that in case of an emergency, we are able to respond and save lives and contain the situation before it gets out of hand or affects more people? So the occupier has a duty to maintain those arrangements and ensure that they are functional at all times. Now, additionally, the head teacher or the director has also the responsibility to ensure that all the people employed participate in these measures. It is one thing to have a set of rules. It's one thing to have the right things, but have no participation from the people who are engaged in day-to-day activities. So whoever is in charge of an institution has that responsibility, both from the Health and Safety Act and also from the Ministry of Education, to ensure that all the people are aware and participate in implementation and review of all the safety and health measures that have been put in place. Now, as we continue, we find that the Ministry of Education has the safety standards manuals for schools, and this manual gave a structure, kind of a structure on how schools should manage health and safety issues, with all the responsibility vested on the head teacher or the director. The director is at the end of the institution is supposed to have a committee, or the guideline says each school should have a committee on health and safety issues in the school. Now, this committee, there's a guideline on how to constitute it, but it will, among others, have representation from teachers, from non-teaching staff, and of course the management. And this committee will, from time to time, meet, do inspections, and discuss matters health and safety in every other aspect of the school. In that, if you are doing, let's say, a procurement, if you are doing a construction, if you are doing a sporting facility, we make sure we interrogate the plans and bring on board safety and health considerations from the design stage, and then the committee oversees the implementation of such safety safeguards for the institution. Again, the guideline or the manual requires that every school shall have a teacher in charge of safety and health, and this is on a day-to-day basis, and reporting to the head teacher or the school director. In other words, we have the committee. The committee, like we have said, will not meet every day. We meet probably monthly or even per term, once per term or twice, depending on the arrangement. But that will not be enough to now like implement the day-to-day activities. Now, the head teacher cannot discharge all these duties on their own. They will need like an extra hand reporting directly to them in terms of safety and health. So just like we have a teacher in charge of games, we have a teacher in charge of boarding facilities or transport. Schools also need to have a teacher charged with health and safety responsibilities, and this person reports directly to the head teacher or the director of the school. Now, so why should we bother with safety and health in schools? And to answer that, in your screens, on your screens, you can see we have two opposing sets. We have unsafe schools and safe schools, and therefore, what we will do over these slides is that we are going to look at safety and health concerns or risk factors. Remember what I defined a risk to be. That is the probability that an hazard will actually materialize and cause harm. And on the safe schools, we have on the other side school-based safety and health proactive measures. What safe schools can do. We have the harm on one side, and the other side, if we are safe, we have to make our school safe, what we are going to do. So we just highlighting a few of the things that we may come across in our institutions and how best we can we can handle them. So security concerns, we can have, and here we are saying that we may have unauthorized access, things like bullying in our schools. And a safe school, on the other hand, will have access control systems, will have security personnel, and will have anti-bullying programs. So if we have security concerns that can happen in our schools, the mitigation or what we can do from another safety perspective now is to have this system in place in our schools. If we have chemical exposures for those schools that have laboratories or even cleaning chemicals of at times, things like fumigation taking place. So if we have these chemical exposures are likely to happen to our learners or even our workers, then what we should do is we have a proper storage of chemicals. We have safety trainings for those handling those chemicals and we also provide the necessary PPEs, including programs on when and how to handle the chemicals, how to dispose, how to check for expiries, and how to do the correct proportions when it comes to mixing of these chemical substances. Of course, electricity is it's nowadays everywhere. Every school you find you have electric power, whether generator or the main supply. And also we have hazards and risks associated with electricity use. So in electrical safety, we're looking at faulty wiring, We are looking at fires that may emanate from electrical faults and such, electrocutions and such things that may happen around electrical safety. And a safe school will have like a system of doing inspections of electrical systems. You say that once in 6 months or in a year, we are going to just have a look at our electrical systems. We engage a qualified electrician to just check and confirm whether we are still safe. Proper wiring and maintenance of all electrical cables and their conduiting. When we look at sports injuries, we say that during the physical activities, during sporting times, we may incur injuries to the learners, mostly to the learners who are engaged with their coaches. And a proper school will interrogate and say, provide proper equipment. If it's a kind of a sport that means specialized protective gear like hockey, you need the head gear for the goalkeepers and the shields for the shin. We make sure we are provided and we have them in place. We also make sure we have a first aid provision. We have a qualified first aider. Some schools may have a nurse. During sporting activities, we may, depending on how big and the magnitude of the games, we may even have an ambulance facility on standby and other measures to ensure that we have immediate response in the event of an emergency coming out of sporting activities. When you look at what we call physical hazards, these are things like slip, trips, and falls, unsafe playground and equipment. This may pose danger to our learners and to the people. During cleaning, for example, when we are doing cleaning, we have a way of putting notices that the floor is wet and therefore slippery and one can fall. So we have maintenance of facilities with the playground equipment. We make sure that we have a schedule for maintenance so that our children don't go, swing on a faulty swing and end up having accidents and injuries. There is something called as ergonomics. Ergonomics is the fitness of our workstation, even the desk. We are saying that if you have a poorly designed furniture, may lead to discomfort and also injuries. Injuries mostly to the back and such what we call muscle and skeletal disorders. So even when we are purchasing our desks, are we able to check at how economically designed they are? Are they fitting for our learners to have proper postures? Are we giving breaks adequately to ensure that people can stand and stretch? And particularly on the ergonomics, when we talk about the desks, you realize that we may have uniform desks in a classroom, but all the learners are not the same size. You may find that some strain to reach the top of the desk, others have to really bend to be able to write. So do we assess these things? Or if we don't say class 3, all the desks are small because they're small. Could be there is someone who young, but their body structure is big. Do we have provisions to make sure that those things or those needs are catered for? We also look at infectious diseases, and this can result into the spread of diseases and illnesses among learners and staff. And I think we all know that children around this time may be difficult to control because they will share everything, they will touch and do these things. So a disease can easily spread. Infectious diseases can easily spread in schools, considering also the numbers. We're just coming out of the COVID, the corona pandemic, and we saw how some of these gatherings can be the spreading points of these diseases. So we have programs for cleaning and disinfection, promoting proper hygiene practices, doing fumigation in malaria-prone areas and other areas where disease vectors are prone. We have programs of ensuring that we keep the safety of our people in place. When it comes to fire hazards, it's common that you find schools ill-equipped for fire safety. You do not have the provisions, or if we have them, not adequate or they are faulty. And sometimes we don't even have emergency response plans. In other words, in case there's a fire and we cannot handle it, how can we be assisted? We don't even have plans on how even the learners themselves can escape to safety. So for this, the law will require us to do audits, will require us to do drills, installation of fire extinguishers, ensuring we have alternative exits, and they are kept in usable state. If we have a story building, we have a way of making sure in case of an emergency, learners can calm down safely. They will not jump over the windows and things like that. And moving on, still we have other risk factors like mental health, that is stress and anxiety among our learners, among our non-teaching staff, teaching staff as well. We're talking of issues of sometimes even drug abuse among our non-teaching staff, especially in urban areas. This can also be a threat to our learners, where the neighboring community as the potential of sneaking in these things into our learners. So do we have systems in place? The mitigation to that will be, or the proactive measure will be, do we have a counseling service in place? Learners who are going through difficult times, some may have lost parents or loved ones, some may have gone through different tough times. Do we have counseling services? Sometimes we are dealing with teenagers, they also have their own issues. But we have counseling for these people and awareness campaigns, especially against drug abuse, safe sex, and all these things. So, in terms of mental health, do we have a program in our schools to ensure we safeguard our learners uh, uh, against such? When it comes to transport safety, nowadays, most of the schools, we find that we have buses, transport arrangements for our children. We also do trips outside the school environment, whether it's a learning trip or for games, such things. So do we have a system for transport management, considering that we are dealing with minors? You know that minors mostly are tricky to handle. They get excited fast. They also follow groups, so running around and doing all these things. So do we have a good transport system? Do we do inspections of the vehicles, maintenance, seat belts? Is the driver trained? The attendants trained? Defensive driving skills, for example. We have first aid provisions in those buses. So these are the things that we can, as a school, be proactive about. When it comes to food safety, our catering departments, we're looking at issues like contamination or like allergic reactions from meals. So we have an understanding of the food safety regulations, and we are adhering to them. We have proper storage of the food and its handling. So we have even medical examinations done for the food handlers, because it's a provision under the Public Health Act. So we check whether we have these things in place so that we can safeguard against food safety related challenges. And when it comes to emergency preparedness, we are talking about unsafe school will have lack of preparedness for any other emergency, something that was foreseen. Emergency is something that will be foreseen, that will catch us by surprise, mostly a negative occurrence. So in the event of an emergency, the unlikely thing happening, do we have a response mechanism? Do we have we practiced it? Do we do fire drills? Do we do uh, response planning? So these are some of the things that we look at in terms of why we concern ourselves with safety and health in schools. Now we look at, in summary, of what we have discussed, we look at the goals of self-taught learning in schools, just from what we discussed on the proactive measures that we can put in place. They're saying the goal is to promote, maintain, and contribute to the understanding of child and staff safety. So health and safety as the goal of understanding and promoting and these proactive safety and health uh, uh, undertakings within our schools. We need also to empower members of the school community to handle disaster uh, in a better way, and therefore minimize the risk, minimize the negative outcomes in case of a disaster occurs. And disasters can be even natural disasters, flooding, for example, lightning, or even strong winds that may, devastate roof or structures altogether. So we empower the school community to be able to handle these things. Providing first-line emergency services to learners and staff who become victims of injury or who are taken ill. We're talking about first aid, evacuation, such things, and also provide a benchmark for monitoring and appraising safety standards in our schools. So the goal of health and safety is to achieve these things in our schools. We need also to have a way of counseling and guiding our learners and staff on issues relating to their own safety and health. We also empower the school to liaise with parents, members of the community, and other partners to increase awareness about issues relating to safety and health. The more we talk about it, the more we make it part of everything that we do. That is how we are going to ensure our schools are safer, schools are taken in the health and safety doctrine as part and parcel of our operations. But of course, we need to forge alliances and networks to enhance the child safety in our schools. So in a summary, a chart form, the goals would be divided into three. So we're talking about the moral goals. We have a moral goal to ensure that we eliminate grief and pain and suffering, and we keep our reputation, even as we have a duty to fellow humans. So it's our goal, it's our moral obligation to ensure that we keep our fellow humans in a safe place. We eliminate grief. Grief happens when someone has lost their lives. And when someone has died, unfortunately, like, all those cases we saw there, the children have lost their lives. The pain when someone is injured and suffering. So, and even reputation of the institution. When such things happen, the reputation becomes bad. So the goal is to eliminate those things from a moral standpoint. From a legal standpoint is to be able to keep away from us things like court cases, fines, and other costs that are legally applicable whenever these violations take place. If wherever all these instances that we saw up there happened, of course there were investigations. We saw them highlighted in the news. So, and, of course, the parent will complain, some other entity will complain, and sometimes they find themselves in courts where now we need to establish if there was someone who didn't discharge their responsibility. And responsibility, like we saw, is anchored on those laws. So you have to understand the laws, and now you put on the responsibility. So health and safety management, if we enshrine it in our schools, or we run our schools, we are able to take care of the legal aspect of it. And of course, there is the economic part of it. And the goal here is to just make sure that we don't suffer financial losses through increased premiums. Whenever accidents happen, when you get an insurance, insurance have a way of rating how much premiums you pay, and what you'll be charged. So the premiums go up. If we have so many accidents, so many health and safety incidences taking place, of course the premiums will go up. If unfortunately they are not insured, of course the owners of the school have the responsibility to take care of that loss, which could be a huge dent to the finances of an institution. Of course, also there's the issue of labor, where people are getting injured or accidents are happening, when people tend to shy away, and even those that are injured cannot continue to work. So you have costs that are related to replacing those people. Someone is injured, they are not coming to work, so we have to get another person and pay them also to take to stand in for those injured ones. Of course, the morale and productivity will go down whenever there are no safe working provisions. Now, to sum it up on health and safety management, there is something called the hierarchy of controls. How do we then make sure we control health and safety related risks and hazards in our places? And we normally have 6 steps. And one of them, the very basic one, is what we call elimination or substitution of an hazard. If you realize something is likely to cause danger or harm, we ask ourselves whether we can eliminate it, whether we can do without it. And if we can do without it, then it means that hazard is completely taken away. If we cannot do without it, can we substitute it to a lesser harmful thing? For example, in the laboratories, or even doing fumigation. If we have dangerous carcinogenic compounds, chemicals that we want to use, can we eliminate them? Can we substitute them with friendlier, human-friendlier, health-friendlier alternatives? What we are calling nowadays organic kind of substitutes in terms of chemicals, yeah? Then we also have another step that we call enclosing or modifying a process. And that would mean if we have a generator, for example, that is so noisy that it is affecting the ears of our learners, can we enclose it? Can we build a permanent structure around it? Can we have like in a room so that the noise is contained? If we have an exhaust pipe from the chimneys and the kitchen where the smoke enters or spreads around, can we modify that chimney so that the smoke doesn't affect our learners? Then the next one will be the use of safe systems of work, whereby we formulate a system of work so that work is done in a particular way. Then we go to modification of the employee behavior. And here we are talking about creating a safety culture. And like the law says, the head teacher or the principal or the director has a duty to involve everyone. The idea is to create a safety culture. So everybody knows that before I do such a thing, I have to think about the safety. Before I begin doing this, I have to take care of safety. Then we go to the provision of personal protective equipment. I think I did emphasize on this for games and also for workers. We make sure in the laboratories we have the protective equipment. If our learners are mixing some stuff that may react in the lab, we have goggles provided for them, or we have like a reaction chamber so that anything that splashes doesn't come to their eyes. Then, of course, we do monitoring and surveillance, health monitoring and surveillance. We do that. Now, we again have what we call emergency prevention and preparedness and response. And we are saying that for this one, we need to be ready for emergencies. And how we can do that is to have necessary information, internal communication and coordination to all people in case of an emergency so that they know what to do. In case of an emergency, does everyone know how to raise an alarm? Does everyone know how to call the fire brigade, for example? Do they even know how to call the head teacher or the responsible person? Do we have such a contact that anyone can call to report an emergency and unsafe condition that is happening? We need also to have mechanisms for first aid and medical assistance, firefighting, and evacuation of all people from the site. We need to also provide information and training to all members of the organization at all levels, including exercise and drills for preparedness. And we are saying that we should also cooperate with external emergency services, the Red Cross, and such bodies. We need to have, because they are doctors on call. They are mostly in every region, so we need to even have their contacts so that in case of an emergency, you can just call directly. The police, for example, if we have a situation that needs intervention of the security agents, do we have those contacts and can we really reach them? Now, you need also to be able to measure performance in schools. And this is you you plan and achieve when the performance that is expected is outlined. You look at where you are, get the actual performance, and establish whether you are doing your standards and put measures in place to ensure there is improvement in terms of performance. And you look at what is the difference, what we wanted to do and what we have done. So what we call performance gap efficiency. You look at, we wanted to have done 1, 2, 3, but when we do our performance measuring, we have done 50%. So why? And how do we close the gap? Now, when you talk of monitoring, we have two approaches to monitoring. There is what is proactive and reactive. Proactive means what we do before something bad happens. We look at things before they go wrong. And we are saying we can achieve this by regular workplace inspections by the organization, but this is internal. From the committee that we said, the former committee, we have that committee active. We do inspections regular, can do it annually or biannually. Or we can do annual health and safety audits, medical examination for workers, like food handlers, health and safety audits for the whole facility. We do trainings like in health and safety, in first aid, in fire safety. We also do our safe work procedures and thorough examination of plants, playground donations, equipment by an approved person, by a specialist in those fields. So these are proactive measures. We do these things before something wrong happens. And this is where we all need to focus so that we be proactive, we do things in before something goes wrong. We just anticipate, we study and say, what can go wrong? What can we do to make sure that it doesn't go wrong? Now, of course, there are reactive measures. And these reactive measures we do when something has gone wrong, and it involves the following. This is number one: we do investigations in case a kid, an accident happens involving a child. We don't just say, we are running, investigate and know exactly what happened. If there's a case of illness, we do a thorough investigation, and not just on the face of it. We go back to the roots. What could be the root cause of what is happening? We look at property damage. If there is any property damage, we look at it. Probably the structure was, for example, strong winds blow, and the roof goes, and the structure collapses. We do an investigation. Maybe the structure was not up to standard. So these are reactive measures. If we have near misses, we also look into them and see what went wrong. So in each case, we determine why performance was not as expected, and we take up the improvement measures, what we learn, what we need to improve on. Of course, there is a provision for health and safety policy that we need to review and see whether we are complying. We analyze, we get data on accidents, trends, we take the lessons learned, and we review our policies in terms of health and safety. How compliant are we? Areas that we need to improve, where it's inadequate, where it's non-existent, and the timelines that we have to use, accidents, illness, and trends, and also the lessons that we learn from such. And as we conclude, there are requirements for workplaces under the law, under the Ministry of Education, under the Health and Safety Act, and these include requirement to do audits for health and safety, to do risk assessments, do fire safety audits. There is a particular legislation known as the Fire Risk Reduction Rules, which specifically targets fire-related issues, what you need to provide, and how much of it you need to provide. Noise and air quality assessments, environmental and baseline surveys to understand the environment that you're operating in. Now, these are done externally, but internally, the institution is expected to do water quality assessments, emergency preparedness drills, and inspections by the committee that we alluded to earlier there. Other requirements for these workplaces will include trainings. We'll train our people on health and safety, on first aid management, on fire, emergency response, on chemical safety for the laboratory and other staff that are handling chemical substances, and environmental management training. We are in the era where we are talking so much about environment, global warming, climate change, and all these things. So we have a way of ensuring we take care of our environment. Plastic pollution, for example. We have a way of training our people around these things. And other trainings may be supervisory and leadership management trainings, and gender mainstreaming, all these things that go around having a safe workplace. So, ladies and gentlemen, I say thank you to a brief presentation, an overview, really. We look forward to having another session where we can delve further into first aid, fire safety, and other aspects of health and safety management. Back to Betty.
So thank you so much, Vincent, for that elaborate training on safety and health for the schools. And it's very clear that it's paramount for us to adhere to some of the safety measures, not only for the learners, but even for the workers and other people who interact with the environment or the school environment. So at this point in time, I'll want to welcome any questions or any clarification if you want to get to this, you want to get to have a clear understanding concerning what Mr. Vincent has trained us about today. So the floor is open for any question. You can just raise your hand, I'll unmute you. Or you can also utilize the question and answer chat box. So Mr. Vincent, as we are waiting for our audience to probably ask questions, how do we contact you? How do we find you, just in case you want to have a consultancy in terms of environment, matters to do with safety and health, and even probably environmental audit? And what are the services that you offer that will be of beneficial to schools?
Yes, like we begin with when we began in the introduction, I did say that we as an entity are registered with the relevant agencies, that is NEMA for the Environment Management Services, DOSH, that is for health and safety related matters, trainings, audits, and NITA. NITA is the National Industrial Training Authority.
Mm-hmm.
And you can reach us through email and also a phone call and our website with a contact form. So we'll be sharing this so that we just share this so that we can be able to get the details briefly.
Okay.
So I'm sharing now.
It's okay. So Mr. Vincent will also share with us his contacts and will be able to share with you via email just right after this session. That's one. And secondly, also for the presentation that has been presented today, we'll also be able to share the slides and also the recordings. Just to let you know that this webinar has been recorded for the issue of data matters to do with data protection, and the same will be shared on our social media, including YouTube and some of our social media pages. So Mr. Vincent has probably wait for you to just share your contact on the screen before we officially end the webinar, because we don't have any questions.
Yes, okay.
Do we have any questions from our audience? Yeah, we have one. Oh, okay, that's your number, Mr. Vincent, yes. So Mr. Vincent has just shared his number in case you want to reach him directly for any matters to do with consultancy in terms of safety and health. He's available. You can also, of course, reach him through Ed Partners Africa. You can also reach me directly so that I'm able to link you up with him. But his number is 0725 515611, and his email is trainings@envirolinkconsulting.com. So if you want to just reach him and get to interact with him and get to know more about how you can adhere to some of these safety and health issues for your schools, then he's available. We'll also continue this session. Today we are talking about safety and health, but our next session will be talking about fire. Now, how to ensure that we are free from such kind of hazards like fire for our schools. And we are hoping now that in our next session, we'll be able to invite a friend, invite a fellow director, invite anyone from the education community so that we can also benefit from this. However, I will still avail the recordings together with the presentation for today and together with visit number or EnviroLink contact so that you're able to contact them directly. So having said that, I want to wish you a good day, and we have come to the end of our webinar. See you next time. Thank you so much.
Okay, thank you.
You're welcome. Bye.